Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, today we can see some important points for exam. We will see some terms today. First point, micturition. Micturition is a process of passing urine. It's a normal process of passing urine is called micturition. And nocturia means excessive urination at night. And dysuria means painful urination. Micturition, nocturia and dysuria. And the next point, pyuria means presence of pus in the urine is called pyuria, and hematuria means presence of blood in the urine is called hematuria, presence of blood in the urine, and polyuria means excessive urine output, and proteinuria means presence of protein in the urine. In polyuria, that is excessive urine output, it is more than 3 liters per day, that is polyuria. And the next point, hepatitis means inflammation of liver, and cholecystitis means inflammation of the gallbladder, and cholelithiasis means presence of stone in the gallbladder. Cholecystitis and cholelithiasis. Cystitis means it's an inflammation, lithiasis means presence of stone in the gallbladder, and nephrolithiasis means presence of stone in the kidney. And the next point, apnea. Apnea means absence of breathing. And next point, tachypnea. Tachypnea means increased respiratory rate is called tachypnea. In tachypnea, the respiratory rate is more than 20 breaths per minute means it is tachypnea, and bradypnea means decreased respiratory rate, that is decreased less than 12 breaths per minute is called bradypnea. Dyspnea means difficulty in breathing. And the next point, aphagia means inability to swallow. And the next point, dysarthria means difficulty in speaking. Dysarthria. And the next point, agnosia means inability to recognize. And the next point, important point, osteoma. Osteoma means benign tumor of the bone is called osteoma. Osteoma is benign tumor of the bone. Osteogenic sarcoma. Osteogenic sarcoma means malignant tumor of the bone. Osteoma means benign tumor of the bone is called osteoma, and osteogenic sarcoma means malignant tumor of bone. And the next point, lipoma means benign tumor of fat. And the next point, fibrosarcoma means malignant tumor of fibrous tissue. Malignant tumor of fibrous tissue is known as fibrosarcoma, and xerostomia means dry mouth. And the next point, lymphedema means swelling of the lymph node. And the next point, xerophthalmia means dryness of eye. Xerophthalmia is dryness of the eye. Xerostomia means dry mouth. And the next point, oligohydramnios. Oligohydramnios means when the amount of amniotic fluid is less than 200 ml at term is known as oligohydramnios. And the next point, polyhydramnios. Polyhydramnios means when the amount of amniotic fluid is more than 1000 ml at term is known as polyhydramnios. Oligohydramnios and polyhydramnios. And the next point, multiple pregnancy. Multiple pregnancy means development of more than one fetus in the uterus at a time is known as multiple pregnancy. At a time, more than one fetus in the uterus is known as multiple pregnancy. And the next point, sagittal suture. Location of the suture will see. Sagittal suture is located between two parietal bone. So the location of sagittal suture is between two parietal bone, and the coronal suture is between frontal and parietal bone, and the frontal suture between two frontal bone, and the lambdoid suture is between parietal and occipital bone. Sagittal suture, coronal suture, frontal suture and lambdoid suture.